Alright, so here we go. Had an appointment this morning with my primary. My insurance has this thing where you can do it by telephone. And so I was able to discuss with her my concerns that I've been having about waiting, and she, I shared the PET scan with her, and I told her, that I didn't know that, or I didn't feel that waiting 6 months was appropriate, although maybe it is, I don't know, and she asked me about the biopsy, and he didn't do a biopsy, and I also told her that I'm not really comfortable with my pulmonologist because I feel like he's just kind of pushing me through, and that he should maybe be discussing things with me a little bit more in detail, and if waiting's appropriate, explain to me why, and I shouldn't have to go and figure this out on my own, which I gotta tell you the truth, okay? This is one of the main reasons why I'm doing these videos, is because this is my opinion, okay? There's not a lot of information out there about stage 1 lung cancer. There's, and it's curable. That's the thing. The success rate for stage 1 lung cancer is very curable. But there's also a lot of fear that goes with that, and I just, that's why I like the primary care that I have. She's had cancer, and she understands. Like, she tells me try not to think about it, but also adds on there that, yeah, you're going to think about it, it's going to be there. It's hard not to let it control your mind, and it's very difficult. And I'm frazzled again today, like I was doing okay, keeping myself busy and whatnot, but just the fact that I had to talk to her about it has kind of upset me a little bit. But here I am, I'm going on about my day, so hopefully my head will straighten out a little bit today. Anyway, she did agree with me that I should probably get a second opinion, and there were some other things on there, like it's called uptake, which, to me, I'm not a radiologist, I'm not an oncologist, I'm not a doctor, so uptake to me, it's one of those red flag words, right? So there's something going on in one of my tonsils, and there's something going on in my colon. And I just had a colonoscopy, and I actually have an appointment on Monday to go back to them for other issues. So I'm definitely going to discuss it with them. That's been the plan all along. But she said exactly what I said in an earlier video. Like, when something like this comes up, you really need to discuss the plan with your patients, okay? You need to give them the whys, the hows, and a little bit more detail with a little bit more compassion. Don't forget that they're not clinicians. Just because you're an expert doesn't mean your patient is. Even if they're somewhat educated, they're still patients, and there's more to it than just, well, we'll wait, or that kind of thing. You need to understand that you're talking about somebody's, now this sounds so stupid, but just, to me it sounds stupid. Yeah, you're talking about somebody's life, and not just their life, but the people around them too. My whole family's upset right now because they feel the same way I do, and if this doctor's wrong, then what? And my friend that I told you about earlier, who said, you're not in imminent danger, that he's not going to let you die. That may be true. I'm not going to discount what she says, because in my logical mind, that makes sense. because he would be putting himself in danger that way, you know, as far as malpractice goes. But I need more reassurance, and if there's somebody who thinks that there's a more aggressive way to go at this, then I want to know. And if this is the right course of treatment to take, I want to know that too. But I want somebody who's going to spend the time, and all I'm asking for is like another 15 or 20 minutes, not the 10 or 15 minutes that my pulmonologist spent with me, you know, just to tell me that this is what we need to do and this is why, okay? And just lay it out to me plain and clear, but with some sort of understanding that I'm dumb when it comes to this kind of stuff. I don't have the education that you have, and that, you know, this is a huge life-changing, and it is life-changing. I am so sorry to say this, but it is life-changing. It's just like I had said before, it's like having a baby, but instead of waiting for a baby to be born, I'm waiting for a monster to be born. That's how I feel about it. It's terrible. It's very uncomfortable. You're just waiting for the other shoe to drop, or whatever image comes to mind. It's a terrible, terrible, terrible feeling, and it's nerve-wracking. And from a clinician's point of view, maybe this is overreacting and I shouldn't be feeling that way, but it's your responsibility to explain to me why, not just tell me that I'm overreacting, because I'm not. You were the ones in the first place that first of all came up with this lung cancer screening, and then you're recommending it to your patients. And I'm not saying by any stretch of the imagination that this was frivolous or unnecessary. I do believe that people need to go and get this done if you fit the criteria, if you've been a smoker for years, or whatever other criteria puts you in that category, then yes, I do believe it's a useful tool, diagnostic tool, or screening tool, or whatever you want to call it. And I do believe that, you know, being proactive and checking before it's too late is definitely better than waiting till it's too late. But it's still scary. You know, people get upset when they get a pimple. Some people do. You know, it can be devastating just to get a pimple or have acne, and I've had it, okay? And I know how horrible it is, but that's nothing compared to this. Nothing. And it just upsets me that so far the interactions that I've had with the professional people have been, except for this one lady, doctor. She's not even a doctor. She's a nurse practitioner, but she's got a better bedside manner and at least reassuring me that, you know, maybe we should be taking another course of action. She's doing what, to me, at least she seems like she cares enough to go to another doctor to get his opinion on it. And maybe I'm in the right place where I need to be, but I don't feel like it. I don't feel comfortable. I don't feel like my doctor's rooting for me, and that's sad. And so next step as of right now is just waiting to see what the head doctor tells her, and then we go from there. And she's going to write me a referral for another pulmonologist and maybe an oncologist. I don't know yet, but like I said, Monday I have an appointment at my GI doctor, and we're going to discuss that and the other things that are going on with me that aren't so bad but very uncomfortable. I guess they're not so bad. I don't know, maybe they are. Maybe no, don't say that. Anyway, I'm going about my day now. I'm gonna go clean a gym. Last week a lady verbally assaulted me there. I've never been treated like that before, and I really don't need that kind of drama right now. So I will keep you posted. Thank you so much for all of your support. I appreciate it so much, and I hope all of you are doing well, and I'll let you know what next steps are. Thank you. Bye-bye.